Okay, hi everyone, and welcome to this U.S. Cochrane webinar lecture on redundancy and research waste. I'm very excited to hear about this topic. My name is Ben Harnke. I'm an education and research informationist here at the Strauss Health Sciences Library, and I'll be running the Zoom parts of this lecture, and I just have a couple of logistics. First, this lecture is being recorded, and we will have a link for that recording. I'll put it in the chat here shortly. As we have a pretty big group, can you please just put your questions into chat? We are monitoring the chat, and we'll get those questions addressed probably at the end. And finally, we do have another webinar coming up in April 24th, and I will be sending details on that webinar to your registration email in the next couple weeks. And with that, I'll turn things over to Tiffany Duque, who will introduce the lecture.
Hello, everybody. Good morning, afternoon, and evening. I'm sure we have people joining us from many different places. You're welcome to say hello in the chat and put where you're joining us from if you'd like. It's always nice to see how global Cochrane can be. I'm Tiffany Duque, and I am Senior Officer at Cochrane, and I'm also the Director of the Cochrane U.S. Health Equity Mentoring Program. So we have two great mentees here today. We have Kaoutar and Claudia. They've put together a wonderful webinar with their mentor, Patricia Heyn, who will be here shortly. She's on a delayed flight, so rushing to hop in. So she'll be here in a minute. And she is their mentor, and they have been working with her on projects around redundancy and research waste and living syntheses. I'm actually set to learn quite a bit today, as this is not my area of expertise, but definitely a main goal and objective of Cochrane is reducing research waste and also, of course, methods for living syntheses. So as Ben said, please put your questions in the chat. We'll be monitoring that. Please keep yourselves on mute. And yeah, with that, I will turn it over to Claudia and Kaoutar to introduce themselves briefly. Go ahead, Kaoutar.
Hello, everybody. Good morning. My name is Kaoutar Ouabicha, and I'm a final year medical student from Morocco. I'm also a US Cochrane Health Equity mentee, and I'm very thrilled to be with you here today.
Thank you, Kaoutar. Claudia?
Okay, yes, my name is Claudia de Santis. It's really nice to seeing you hold this webinar. I'm part as well of the Cochrane's mentoring program, and I've been sorry, I am a research access aide for the Maryland University, especially the Center of Optimal Aging. And yes, I'll talk with you later. Now I'm leaving again the floor to Kaoutar so she can give us an overview of the background of what you're going to talk about.
Wonderful. And Claudia's from Italy. All right, go ahead, Kaoutar. Thank you so much.
Well, before we dive in, I would like to thank my mentor, Dr. Patricia, and also you, Tiffany and Ben, for this opportunity and whose support has made this event possible. So through our time together, we will be in an overview of the method. Claudia will discuss the effects of randomized exercise training on cognition of older adults with cognitive impairments, which is an umbrella review that is in progress. And she also will discuss redundancy and research waste through this living synthesis. Well, first of all, systematic reviews according to Cochrane handbook are seek to collate evidence that pre-specified eligibility criteria in order to answer a research question. They also have an explicit reproducible methodology. They use a systematic research that attempts to identify all the studies that would meet the eligibility criteria. They also assess the validity of the findings of the included studies, and they use extraction techniques to synthesize the data from the study's presentation. On the other hand, meta-analysis are the statistical combination of results from two or multiple original studies. They improve precision and generalizability through results through quantitative synthesis from those multiple studies. So what makes systematic reviews and meta-analysis strong is that they have a comprehensive synthesis, which means a structured overview of existing evidence on a particular topic, allowing practitioners, policymakers, and researchers to assess and consolidate summary of knowledge. They also minimize bias by enhancing the reliability and trustworthiness of the findings, as well as identifying gaps by highlighting areas where further research is needed by assisting researchers in prioritizing future studies and focusing on areas with the greatest need for additional evidence. They also have some challenges, which are time lagging between the included literature and publication of the meta-analysis, which can introduce a risk of outdated evidence. They also contribute to research redundancy, as well as variability in studies, designs, populations, or interventions, which can make it challenging to combine and interpret the results of individual studies. So actually, living systematic reviews can solve some of those challenges because they are underpinned by continual active monitoring of the evidence, and also they immediately include any new important evidence that is identified, and they support by up-to-date communication about the status of the review and any new evidence that is being incorporated. Here in the right, we have a graph that compares the components of the emerging health knowledge ecosystem, which is the outer circle, with the current health knowledge ecosystem, which is the inner circle. So why are living systematic reviews necessary on high traffic topics? So due to the dynamic and the rapid evolving nature of research in so many areas and the high volume of research publication generalized, it can overwhelm traditional systematic reviews process, making it challenging to keep pace with new evidence. So, living systematic reviews provide a way to address the rapid influx of the new evidence synthesis and ensure the most current information that is available for decision making, thus minimizing the risk of redundancy and waste, which ensures that the efforts are directed towards addressing gaps rather than duplicating studies. Here we have a graph that highlights the formula of innovation, which by incorporating creativity and coming up with new ideas, acquiring the knowledge to act on the ideas and execute the knowledge to deliver the outcomes, we can demonstrate innovation. However, when we acquire knowledge and execute a solution without generating ideas, stagnation can occur. So as I said before, in recent years, there has been a proliferation of systematic reviews addressing the same question, often without any justification, and there has been a strong call to control the unnecessary duplication of systematic reviews and the confusion and waste it generates. So with that in mind, it is important to distinguish between replicability, reproducibility, redundancy, and research waste definitions. So replicability is reperforming the experiments and collecting new data to verify the findings of the original research question. Or reproducibility is reperforming the same analysis with the same code using different analysts to ensure the reliability of the results. However, redundancy is the unnecessary or unacknowledged repetition of systematic reviews without a clearly defined purpose, leading to research waste and potentially misleading results. So now that we've distinguished, also it is important to note that these definitions are inconsistent, and there has been a contradictory uses of the terms reproducibility and replicability by different disciplines and institutions. So now that we've discussed the importance of replicability and reproducibility and the pitfalls of redundancy, let's delve into another crucial topic, which is research waste. So research waste refers to the avoidable and inappropriate conduct and the dissemination of research leading to a loss of resources and reduced benefits without producing valuable or impactful outcomes. It actually can occur in 5 stages, which are question selection, for example, selecting the wrong question, study design, research conduct, publication, and reporting. Addressing research waste is very crucial for ensuring the optimal utilization of resources and promoting efficiency by directing resources towards research that yields valuable and impactful outcomes. Finally, by embracing the principles of replicability and reproducibility while carefully managing the risks of redundancy, the scientific community can work towards a more sustainable and impactful future where research waste is minimized and the value of scientific evidence is maximized. And with that, I will give the floor to my colleague Claudia, who will explain more in depth about the topic using our umbrella review and our living synthesis. Thank you.
Thank you so much, Kaoutar. So after all this definition that I hope clarified what we're talking about and underline also the complexity of this topic, as this definition are kind of bewildered around literature, I'm going to present you a practical example from our research team. So we are talking about the effect of randomized exercise and training on cognition of older adults with cognitive impairment. The need of assessing the prevalence of studies on this topic can be traced back in 2004, when Dr. Patricia Heyn published this meta-analysis, here, first publication, that evaluated published articles and non-published manuscripts about exercise intervention in person aged 65 years or older with cognitive impairment. The research team, after creating the first meta-analysis on this topic, to our knowledge, decided to delve more and publish an updated second meta-analysis in 2008. So after these 2 meta-analyses, it was possible to assist in the research community to a sort of literature explosion on this topic. So in 2015, the team decided to start a new data collection targeting only meta-analysis. So we can see a shift from 2004 and 2008, they were just collecting randomized control trials to the collection of just meta-analysis, deciding to adopt a living umbrella review. So before continuing about our living review, let's answer an important question. So why there are several studies about this topic? First of all, we need to answer this other question. Why should we care about Alzheimer's disease and cognitive impairment? So first of all, Alzheimer's disease and cognitive impairment are conditions for which there is currently no cure. You can see here also some key facts about Alzheimer's disease. And as there is no cure, prevention and management of this condition are crucial in research. So there is an urgency in addressing risk factors and promoting preventive measures like physical activity. As the prevalence of this condition is on the rise globally, as the population is aging, the burden of this condition is expected to increase greatly as well. So studying intervention and implementing intervention of physical activity towards the population that is aging is going to benefit us greatly. Another characteristic of a condition that involves cognitive decline is that they not only affect the patient, but they also affect the families, the caregiver, and the whole community. So this condition can significantly decrease the overall well-being of a population. And as I said, researching into prevention strategy is fundamental. Physical exercise, as I say, is one of the most widely recognized preventive measure to to aid cognitive decline in people with Alzheimer's disease and cognitive impairment. So here I'm presenting some results about a meta-analysis from 2004. And you can see here very briefly how physical exercise appears to have a protective effect in cognition outcomes for people already suffering from a form of cognitive decline. So in other words, physical exercise can prevent the worsening of the condition. As Kaoutar really well explained, like these results have been rightfully replicated with a lot of meta-analysis, with a lot of randomized control trials. But when we go from rightfully replication to excessive replication, this kind of result can become redundancy and adding not a lot to the current state of knowledge. Let's say it like that. So you can see here part of our redundancy evaluation in which we analyze the data, as I say, collected from the umbrella review. So we can see on the first graph here on the left, the increasing number of meta-analyses being published from 2004 to 2023. These are from the 38 meta-analyses we include in our umbrella review. You can see that in 2022, 8 meta-analyses on the topic were published, while on the right, you can see the number of studies published from 1974 to 2022. We can see that in 2008, as I said before, there was a sort of explosion of literature with 15, I think, randomized control trial study base published on the topic, reaching their peak in 2017 with 28 original studies published on the topic. That's kind of a lot. Let's see 2 interesting facts. So in 2019, you can see that the individual studies published, they're following, you can see a decrease here. We're trying to explain this trend with the COVID pandemic. Like when we're talking about elderly management and geriatric healthcare, with the COVID pandemic, it was rough. There was a shift, of course, in attention. However, the number of meta-analyses that did not fall, like this kind of fall you can see can be justified by the fact that the meta-analysis require 2 years to be published. So let's make an example. In 2018, there were like 4 meta-analyses. The topic is a nice trusted topic. The research team see the topic is trending. They write the research, their meta-analysis, they take 2 years, and then they publish more. And now we have 6 meta-analyses, and then after 2 years, we have 8 meta-analyses. This is kind of interesting. So it's also a clue about redundancy in this topic, because we did not create new RCTs. We did not create new, so we did not study new population, new intervention, nothing. Not nothing, of course, because something has been published, but not so much as 2017. But then the meta-analysis have been published with the same randomized control trial. So this is a clue about the redundancy we're going to talk about. Another interesting fact is that we saw on Prospero, that is a database for protocol for systematic review and meta-analysis, and we saw 4 new ongoing meta-analyses about this topic registered in the last year, so from January 1st to the current date. So therefore, taking into account the explosion of literature, it was necessary to create an umbrella synthesis and including meta-analysis instead of randomized control trials. To summarize also some other point about why it is important to do an umbrella synthesis, you can read them here. So it's important because it's the synthesis of the highest available evidence on effect of exercise on cognition in older adults with cognitive impairment, because it gives us an opportunity to appraisal the quality and level of current meta-analysis evidence. And it gives also a chance to develop clinical recommendation and research recommendation based on the current highest level of evidence. And probably this last point is the, let's say, the most important one, in my opinion, at least. So something about our methodology. You can see our preliminary title here, because this umbrella review is still ongoing. It's a living systematic review, and we are almost at the end of all the steps required by creating an umbrella review, and hopefully close to publish. So each phase of an umbrella review was validated by at least 2 independent reviewers. data collection was performed 4 times from 2015 to 2053 by an information specialist. We use some software, maybe you know them, and Norton Covenants to help us with data collection and extraction and so on. And as the team is spread all over the world, we connect virtually and we use a database update notification on the topic to be sure that we were missing something important being published. And we use Excel for our data analysis about the redundancy evaluation. So maybe a lot of you are already confident with the steps of evidence synthesis, so I'm not gonna spend too much time here, just I'm highlighting some points. So we register our protocol in Prospero. We, of course, have inclusion and exclusion criteria that were kind of narrow. For example, any studies, any meta-analysis we included had to have a cognitive outcome, or at least included cognitive outcome. And we decided to exclude the multi-component exercise and mind-body exercise from our intervention criteria. And we are in the phase 5 reporting right now. So data extraction, analysis, and summaries, we are working on it. Yes, here again with the methodology, you can see our database. There are a lot. And we didn't put a time range in our data collection. So we got from the oldest meta-analysis we could get, the one in 2004 from Patricia Heyn, to the current date. Here you can see the date of our data collection. So 2015, 2018, 2020, and October 2023. Yes, okay. This is our Prisma diagram. Is a little bit partial because we did 4 data collection. So a lot of meta-analysis were updated and included in 4 times. We reached a total of 38 meta-analysis in our umbrella review. Considering these 38 meta-analysis, we decided to do a redundancy evaluation of this umbrella, of this living umbrella review, with 2 aims in mind. The first is to evaluate the redundant representation of randomized control trials across the included meta-analysis and the implication in the interpretation of the evidence in clinical recommendation. And the second one, it was to evaluate the synthesis quality, bias, and rigor through AMSTAR evaluation. The second part is still ongoing, so we are not gonna be able to present this, but just to introduce it a little bit, it's very important when we talk about research waste, that we talk about the quality of, when we talk about research waste in evidence synthesis, we need to talk about the quality of the articles we are talking about, because that's part of it. To answer this first question, so I'm going to present you our findings right now using different graphs, so we can see this issue from multiple angles until you cannot hear about this anymore. So this is the meta-analysis weight on body of evidence. As I said, at the end, we analyzed 38 meta-analysis for a body of evidence, like the whole body of evidence comprising 692 articles. So in this graph, you can see the actual size of each meta-analysis node, representing the number of studies included. So larger circles indicated meta-analysis that included a greater number of studies. So we can see the weight of them. For example, meta-analysis 24 is kind of big, and probably this is the meta-analysis that included 72 individual studies. That is the maximum number of studies including a meta-analysis that we observed. And then the minimum number was 6, and probably that's like this tiny circle here. So after we assess such a huge body of evidence available on the topic, so 692 studies, we needed to assess how many times this meta-analysis actually included novel material. So in other words, we need to check if these meta-analyses are including the same randomized control trial over and over or not. Spoiler, yes. So, and to assess the magnitude of that, we needed to calculate what is called redundancy rate. Here you can see the definition. And in our context, the redundancy rate indicates the extent to which randomized control trials are repeated across the meta-analysis. I hope this is clear enough, but now it's going to be more clear as we look at this beautiful graph. So this graph represents the whole body of evidence, so the 692 articles that were divided by individual studies and repetition or replication. So you can see here the definition. Our individual studies were composing the 39% of the whole body of evidence. And there were studies that have been included at least once across the 38 meta-analysis. The individual studies can be divided in unique studies, so studies that have been included just once, and into repeated studies, so studies that have been included at least twice across the meta-analysis. So this huge yellow slice here represents 111 studies that have been repeated for 425 times. Okay, I'm gonna repeat this again because it's actually the main point of all of it. So our redundancy rate is 61.4%. So it's more than 60%. Our whole body of evidence is composed for more than 60% of replication or repetition. So it's composed by these 118 studies repeated for 425 times. So these high redundancy rates suggest a great level of overlapping or replication with the available evidence. So now let's see more in details how many times our 118 studies have been repeated. In other words, how our replication are distributed within the whole body of evidence. Okay, here, so you can see again the whole body of evidence, 692 studies. Yes, the individual studies still composing the 38.6% of the overall body of evidence. And here you can see the subdivision by level of repetition of the 425 replication. So we have a certain number of studies that have been repeated from 6 to 10 times, providing us a total of 169 repetitions. We have sub-studies that have been repeated from 3 to 5 times for a total of 131 repetition. And we have even like a total of 70 repetitions composed by studies repeated from 10 to 17 times. So actually interesting to see the weight of this replication within the whole body of evidence, you know? So even if considering these individual studies, this weight, the weight of a replication is kind of remarkable. So now let's look at this issue from another perspective, and let's assess how many individual studies, so this part, just the green part, how many individual studies have been repeated for a certain number of times. See, now we have 149 studies that have been like, we call them unique studies, they have been repeated just once. And they actually the more than 50% of the whole overall individual studies. I'm sorry. Then we have 26 studies that have been repeated from 6 to 10 times. So this is the actual number of studies. Now let's go back a little bit. Now we see 26 studies repeated from 6 to 10 times that compose 25% of the whole body of evidence. So these two graphs are important because we can see how few studies are actually composing our body of evidence. So how much weight the studies have in determining the body of evidence, you know? So continuing on this, like this, we have 48 studies that have been repeated from 3 to 5 times. And now we have 37 studies that have been repeated 2 times. And that's a lot. And then we have also 7 studies that have been repeated from 10 to 17 times. So yeah, as I say, let me repeat myself. This graph is important because it makes us understand how very few studies have a great weight in the overall body of evidence. So when we are going to draft our conclusion, taking all this body of evidence, we have to take this in account for sure. Now let's delve more about these 7 lucky studies that have been so important to be repeated from 10 to 17 times, because the studies won our most included article awards. We have at first place Kimon, Venturelli, and Brugdenil. That has been included across our 38 meta-analyses 17 times each. Then we have in second place Timberg, in third place Althoff, and very close to the third place Van der Winkel and Scherder, the consolatory prize here. But we have to take in account something else about the fourth place. They are very, let's call them old articles, is 20 years, that they've been published 20 years ago mostly. And the fact that they've been included 10 times across even most recent meta-analysis, it's kind of impressive. So this is probably very important articles, and the quality evaluation of these studies is going to be very important. Now, let's look at this visualization. This visualization allows us for an explanation of how the frequency of study replication has varied over time. So each dots represent individual studies. Dots can overlap, so don't count them because they are overlapping. They're not 267. And we can see that before 2004, studies, you can see here, were published mostly once. Actually, we calculate that we had 34 studies published before 2004, and 28 of them were cited and included only once in meta-analysis. So why this graph is important? Because if we wanted to assess the redundancy rate of publication across this meta-analysis in modern and current years, probably we could probably see that the redundancy rate is going higher. So if we would just put a time range, instead of including everything, like a time range at 2004, the redundancy rate that we measure at 60% is probably an underestimation of what is happening right now in modern years. And that's, I don't know, food for your thoughts, I guess, because saying that 60% is another estimation of redundancy rate going on this topic in modern years, it's kind of strong statement, but it is what we analyze. So I hope I didn't talk too fast because we are already in the conclusion. So as I say, that's our main limitation in our redundancy evaluation. We may have underestimated our redundancy rate in modern years. Also, the exclusion of mind-body exercise and multi-component intervention may have led us to overlook some meta-analysis. So let's say that future studies on the topic could also set a time range to estimate this redundancy rate, or see the effect of redundancy in modern years, mostly. However, based on our methodological analysis, it's evident that this topic is being extensively covered. So what we would like to ask ourselves is this: what is the value added to research and especially clinical recommendation when over 60% of the evidence is based on replication? So that's a question I'm going to leave here for a while, because it's important to think about this. So additionally, we noticed that certain meta-analyses included various studies that were based on the same randomized control trial. So it led us to think to another concept, that is a concept of redundant publication. So redundant publication consists in publishing different studies with different journals, but from the same randomized control trials. So sometimes this can be justified if the analysis varies. For example, you assess in one randomized control trials different intervention, and you publish different studies analyzing the different intervention. But we found cases in our meta-analysis that the research team basically did not publish very novel material. They published the same article twice, basically. So And as this happened more than once, we wanted to state that in a way that author of reviews, the author of evidence synthesis are aware of what is redundant publication and can put a little bit of attention on this when doing a systematic review or a meta-analysis. Probably all of this is part also of publish or perish character, publish or perish research character, I want to add, but it's important to be aware of this can happen and stating this when you are doing an evidence synthesis effort. Let's conclude with a nice note. So there are actually something that we can do to reduce research waste when we're talking about evidence synthesis. So first of all, for sure, continuing to adopt rigorous procedure. For example, the one by Cochrane, of course, but also from JBI, using Prisma. Writing evidence synthesis requires this kind of procedure, because this procedure, as you can see here in the screenshot I took from the Cochrane handbook, this kind of procedure asks you to cite any similar publication, and the researcher have to acknowledge existing literature, existing literature to reduce duplication and to improve research quality and a more efficient use of resources. On the same line, another tool that we thought about, another best practice maybe to reduce research waste, was registering your protocol on Prospero. Prospero is a database that, it's a database that included, it's a database of protocols of evidence synthesis. So it enhanced transparency within the scientific community, enabling researchers to share their plans and findings. So if you have a great idea for a topic, sometimes it's better to create your protocol or just go to Prospero before even creating the protocol and see how many, of course, like a part of the normal literature search, a literature review before doing the protocol. It's important to register yours, to see your effort, to see how many other research teams had your same idea or similar. So I screenshot here the main page. You can find it online very easily. Another tool I'd like to present to you is this beautiful checklist made by more than 20 great professionals. This checklist answers the question, when to replicate systematic reviews of intervention? Because as the most experience between you knows, it's not always a yes or no question. No, because there are several factors when deciding to do a systematic review. So it's complex. And this checklist has been published and created by a consensus meeting and reviewing literature involving several stakeholders, from community leader, patient, clinicians, researcher. So it's a checklist that is made by everyone, let's say for everyone, maybe. So I totally suggest to look at least this up. I put here a screenshot from the article with the table of the checklist. And yeah, it's a great tool that can be used by a lot of people before deciding if it's worth or not to replicate a systematic review or a meta-analysis of intervention, of course. This is based for well-being and healthcare intervention. On a different note, we wanted to give you some tools to identify redundant submission. I'm leaving the name here. We didn't check all of them, but they should not only perform plagiarism check, but they should also give, as they have access to a lot of database and literature, they facilitate the detection and overlapping of content and redundant studies. So they are great tools that editors and publishers can use to identify if a paper that has been submitted to them is actually filling the famous literature gap or knowledge gap or any kind of gap publication are trying to fill. So yeah, please check them out and maybe you can find something interesting. Also, something that's important is a question open for you. Maybe you know other tools that you want to share with us, and that will be great. who knows what will be available in the future. Like these technologies continue to evolve, and maybe we are going to see other great tools just dedicated to redundancy, as we are starting now to talk about redundancy. So that's it. And I want to thank you, all of you, for your attention. And I'm seeing maybe there are already some questions. You can find here my email and Kaoutar email. And also, if you want to know more about the Cochrane US Health Equity Mentoring Program, you can find the website here. It's been a great opportunity. I think I can talk for Kaoutar as well, this program to boost our research experience, to connect with so many professionals. It's in this way that we met Dr. Patricia Heyn from the Center for Optimal Aging, Marymount University. You can find also the website for here for seeing the activity of the center. And that's it. I think we have time for questions. So thank you, everyone.
Thank you so much, Claudia and Kaoutar. That was so fascinating and really interesting and very well done. The slides were really good. I see that we do have Dr. Heyn here. She was able to join us. So Dr. Heyn is the director of the Center for Optimal Aging at Marymount University and also a mentor. She's been a mentor all of our years for the US mentoring program. So this is her probably fifth and sixth mentees that she's mentored. And this looks like an incredible project that they're helping her with. So I will turn it over to Patricia to lead us through some of the questions. I see we do have a number of questions, and Dr. Heyn, you had some great thoughts about how to start the discussion.
Yeah, that was great. Thank you so much, Claudia. Thank you, Tiffany, Kaoutar, and Ben, everyone for supporting this webinar, which is so important. It's such a topic that we really need to think about, and there is so much development into this area as science keeps growing. We're going to see more reviews, more synthesis, so making sure that we are driving innovation and not saturation is going to be the key for our future scientific developments. So I will say, they are doing such a great work, and it's such a pleasure and honor to work with Tiffany and the mentoring program. We have all this talent. If it wasn't for Claudia and Kaoutar, we will not have the presentation today. They really took that to another level, and they are the future. So it's so important that we train our future scientists to always calibrate our science and do the right thing. But meantime, what guidance could we start to think about providing to the field? So I am in so many editorial journals, and we get those wonderful syntheses and meta-analysis, and very well done, and always, they sound perfect and a contribution. So how can we start to identify how we can help the editorial managers and the reviewers on identifying when there is no longer innovation, there's such a repetition, especially for our librarians, like what could be the technology, what we need to go, where the field needs to go to advance this such unmet area. Anyone has some suggestions? I saw some interesting suggestions in the chat, but I would like to open this now for a free discussion, and we will love for our trainees to also get some input and some feedback from the audience. Any takers?
Patricia, I liked the question from Lucette that asked, is there an ideal amount of replications? I think that's a good question because, for primary research, especially, you want your work to be replicable. And at what point is it considered, kind of like done?
Yeah, that's a very good, because we need duplication, and we need duplications that are unbiased, that comes from different laboratories, different teams. So definitely the duplication is important. Now the question is how many do we need? And certainly some topics, I think they're going to need more duplication. So if it's a new pharma development, a new compound, if are like biomarkers, so it depends of the nature and what is the goal and the aim of that scientific development. So definitely duplication and looking at different angles through the same lenses is important. But there are topics that definitely we need to start like to ask other questions that we still don't have a good answer. And so on this, you know, even though it's really to my heart, this topic, I start even to get a little dismotivated because was so much repetition that I end up like not even like feeling like motivated to keep doing this science and start like to look like how I can, you know, advance, what are the gaps, what I need to go. And so I would say, you know, once we see that's working, once we see that we can implement in our communities, once that is translating into the consumers that we do our research, I think that should be enough of that science. And then we should start to ask what is not yet being meeting, like what is the unmet areas. So we know from this, like there is a big push with the CDC, Alzheimer's Association, and many other organizations that now they have the Healthy Brain Initiative. So the HBI now is going to the state departments, the state health departments, where now they have to start like to create those approaches, develop exercise and nutrition and lifestyle behaviors that support the older adults living in the community based on the science that we already learned. So that is already being implemented at the health department at the state level. So I think that's a good sign, shows like now the science is moving to the right direction. But we still see, like Claudia said, you know, there's another 4 protocols that are being developed, and probably because this is such a topic that still creates lots of citations, we're going to see that we're still going to be repetition. And so there are several questions that we still need to learn. As an example, like combination of modalities, I would say we don't know much about those. We just, you know, all those, most of those studies just put it like, you know, exercising to one baggage and doesn't really dissecate some of those components what we call prescription. So really looking like a different prescription, different modality, what's the intensity, how many minutes every day, 3 days, how it's going to work for the brain, how that work, what it works for the brain and what works for the heart. So there's so many areas that we still need to tap that we are not really exploring. Yeah. Okay, any more questions? So Jacqueline's saying,
There was one in the chat by Ayush that is a fellow mentee, and I'm very happy to answer this if I can, Patricia. So he asked if amongst the later publication, those authors were obviously or mostly aware of the replication. Have they provided any reason in their paper for repeating the meta-analysis, maybe in the discussion section? So we are still doing the quality evaluation of these, and this is gonna part of it, of course. We can see by the meta-analysis I have, let's say, collected and extracted, sometimes probably this part, so Agnologi's previous literature of the topic was not being present very truthfully, in the sense of, as I explained, using procedure like Cochrane, Prisma, JBI, reduce this, because before publish, you're required to do this evaluation, you're required to present it in a very clear way. So the concept of new evidence is more evident when you're writing. So was authors are mostly aware of the replication? We can say maybe all of them were aware, I don't know. But among the one who stayed that, of course, there were, but probably that was not a reason enough for keeping them from providing new evidence on the topic. Like 60% of redundancy rates is kind of a lot. So your question is really good and on point, but we have to question this as well.
And we are in a conundrum, right? Because we teach our scientists that they need to be cited. So there is this push for citations, that your work has to be acknowledged, and how more cited you are, it's better for you. And so the impact is based on your citation level. And I think that also has an interference, is a factor on that science. So whenever there is a science that end up generating high impact, is going to drive researchers to develop the science, because they are looking for that citation, they're looking for that impact factor. And so I think also maybe we need to start to rethink a little bit about that, because maybe this approach, this belief that it has to be driven by citation, is also interrupting the process of innovation. And then it's just, also supporting the idea that that duplication, keeping the knowledge into the state is supported by science that it has a high impact factor, and then is driving the scientists to keep doing kind of the same work. So lots of things to think about. We don't have a solution, but I think definitely, I just love when they brought that into, when we're doing this living systematic review, actually is a meta-analysis, that when we found like the duplication, we were so horrified by it, because we never thought about that much. And so it was really a discovery through doing it. And that's why Claudia said it's so important to do those living reviews, because that's when you find out if there is really a process of innovation, advancements to the field, or if there is a saturation or stagnation, is by doing that kind of evaluation. So I agree. I think more living reviews are going to be needed in those hot topic sciences that have a very important impact in the field. We found by chance, wasn't what we were looking. So.
We have another question from Jacqueline. You know, if you wanted to answer that, Patricia. So she said, if we have some thoughts of developing a practical strategy for discovery, because there are a lot of places one might search to discover protocols behind Prospero, and she finds this challenging for identifying possible redundancy.
Yes, and that's a question for all of us. And Claudia, you were, as you were doing this study and preparing the presentation, you were really thinking so deeply about how technology, we have AI, and we have so much development, and now NLP, natural language processing. So I feel that we're going to see, so sorry about that. I feel that we're going to see a change in the field by the technologies that are available, and that our computer scientists are going to be developing more and more those technologies. But I would like to open, and for all of the one here present, and including our speakers. So when you were doing that work, what did you learn? What did you think? What's going to be the future? How you see yourself being a methodologist, synthesis, how you feel that you're going to be developing your career, and what kind of tools is going to help you to do the work needed for the future?
Well, I can go first. So for sure, for me, this kind of work highlight the complexity of the topic. So what we're trying to do, we're talking about, research waste in a living umbrella synthesis effort. Even the name are complex, So there are so many concepts and things to think about, even just saying these 4 words. So what I gained the most of it, it's okay, it's a great exercise for sure, but is that we should not, at least in my research practice, I would not like to overlook this complexity by reducing too much the argument. So I would like rather prefer to maybe spending more time of analyzing redundancy, of seeing the reference list very truthfully when it's presented, and all this kind of micro practice that maybe make us work as a early career researcher, at least, or as researcher, a little bit more repetitive, but it's fundamental. So until we wait, let's say, for AI tools or any instrument that could, like we use Covidence, we use the EndNote, before that was made by hand. So when we are waiting for tools that hide us in redundancy and understanding if you're feeling the, I say, the literal gap or whatever we are feeling, I want to keep this with me, spending more time doing this micro research practice to achieve a better quality, because maybe it's also a way to not fight, but in my little see about this publish or publish culture that we see a lot. As an early career researcher, I'm feeling the the weight of not having a publication on my shoulder or all this kind of stuff. So it's something to think about and take it with me, of course. Thank you for the question.
Well, for me, I think as a future doctor and a future researcher, it is important to address this problem, because as I am applying to the match for residency in the US, we need to have lots of publication under our name, and we need to be involved a lot in research. So this webinar and this subject particularly highlights things that for me will be looking for example, before starting any new research project, I should really do my homework and look for any similar studies that has been done, and see research gap rather than duplicating existing studies, and eventually contributing to the research waste. So yeah.
Now we're almost reaching the time, but I was curious, like Ben from the library perspective, and Tiffany from Cochrane perspective. Any pearls to add?
No, this is not my technical area of expertise. So it's great that there's all of you in the Cochrane community to talk about this.
Well, I did pose the question a little earlier in the chat, like what could librarians do? And I have to admit, I perhaps don't do my own due diligence when we get a review request to like go out there and see what's already out there. I probably rely on the researchers more to know that literature coming into the review. I just assume if folks are going to attempt a review or systematic review, meta-analysis, they have a good feeling for the literature. But perhaps, for our search service, we do have a formal search service, and we do require a protocol form for all folks who are going to attempt a systematic review. So maybe we need to build that into that protocol form. Something about like what other work has been done on this topic, and how will your work either support or differentiate from that prior body of work, something like that. So yeah, so I'm already like the wheels are spinning in my head. How can we as librarians, information specialists, help mitigate this? Yeah. I don't know if any other librarians, I think we're small enough now that if somebody wants to unmute and chime in, we have like 1 minute left, so we'll probably have to wrap it up here in a second, but.
I would say I'm thrilled, Ben, that you're saying that. And I feel like for Claudia and Kaoutar, they should be so proud of themselves because that's the impact. You know, doing a work, doing a presentation where you can say like, you are informing and then you are also initiating approaches where there can be a change. So that's phenomenal. That's really like, and you know, your vision being like to start to think about how we can maybe, you know, add a simple item in the tool that can make a difference or helping decrease the potential of saturation in the field is so phenomenal. And you, Claudia and Kaoutar, you should be so proud of yourself because that's like, you know, the nights without sleeping, doing the study and all the extensive data prepare, that's payoff. But for what Ben just told us, like, you know, he can use this information and do something with it. So that's a huge gift. Yeah.
Thank you also for providing us the opportunity to explain what we have done so far. And really, it was an amazing experience. It also teaches us a lot about data visualization. I learned how to analyze data on Excel. So amazing opportunity, really. Thank you.
Thank you so
Yeah,
much. This
thank you
was really
so much.
wonderful. Oh, go ahead, Kaoutar.
Yeah, that's it. I was just thanking Dr. Patricia and you and everybody that's attended the webinar, and that's it.
Agreed. Ben, we'll look forward to the next webinar.
Yep, everyone will receive an update in their registration email. Thank you, everyone, for attending.
Take care.
Thank you.
Bye.